Case 2 is a 70-year-old man with Parkinsonian symptoms. Here we have a sagittal flare image through the midline. And here we have a couple of axial images through the midbrain and suprasellar region. Question 2a is, what is the most likely diagnosis? And question 2b is, why is it important to make this diagnosis? I'll give you a chance to read those answers. Here we have a case of progressive supranuclear palsy. PSP is the second most common neurodegenerative cause of Parkinsonism. Has symptoms of postural and gait problems, gaze difficulties, and dementia. But the imaging findings that you want to be concerned about are this midbrain atrophy, which gives you a hummingbird or a Mickey Mouse appearance of the midbrain. Here you see this is a paper from 2004 in AJNR. You see the spectrum of the disease. Normal midbrain has a nice convex upper margin. When you have early disease, it has linear appearance, and as the disease progresses, you get a more concave appearance. Here you see our case. The midbrain has a concave appearance. If you look at the axial images from the same paper, it shows a progressive widening of the interpeduncular cistern over time. As the disease gets more severe, as I mentioned, the midbrain takes on a Mickey Mouse appearance. Here you see in our case, the interpeduncular cistern is quite wide, and again, it has this Mickey Mouse appearance of the midbrain. The reason it's important to make this diagnosis is that it does not respond well to Parkinsonian treatments. It has a worse prognosis than Parkinson's disease, and it doesn't respond to treatments like deep brain stimulation. So the answer here is all of the above.